Hey everyone, this is Mariah with CDPHE. I'm just going to give it a quick minute before we get started. Thank you. All right, I'm just going to do a sound check. I think I'm just having a slight technical difficulty, so just bear with me one moment, everyone. Thank you. All right, I'm still having some audio challenges here that I'm working out, but I did just want to welcome everyone and thank you for joining us here today. We will be having Dr. Rachel Herlihy joining us from CDPHE, State Epidemiologist, and also Kathy Ritter, the Director of the Colorado Office of Tourism. So just a quick sound check. Dr. Herlihy, can you hear me?
I can. Can you hear me?
Okay. Yep, we can hear you great. And Kathy, are you able to hear me?
I can hear you.
Fantastic. And we can hear you as well. All right, so we are going to begin today with just a couple of slides and we'll share some information and then we'll do questions at the end. When it comes time to ask your question, if you could please use the raise hand function. So to do that, click on your participants icon and then the raise hand button. And that will let me know that you want to ask a question and I will unmute you and let you know when you're on the line. So we'll go ahead and get started and then we'll take questions at the end.
And Mariah, I'm not able to see the slides yet.
No problem. I'm going to get them up for you shortly here. Sorry about that. All right, we're at the end. Hang on, everyone. Okay, well, again, welcome. We're so happy that you're here to join us. And just to reiterate, I'd like to introduce our speakers today, Kathy Ritter, Director of the Colorado Tourism Office at the Office of Economic Development and International Trade, and also Dr. Rachel Herlihy, State Epidemiologist with CDPHE. To start off, I'm going to hand it to Kathy.
Thank you, Mariah. I'd like to talk to you today about a new initiative we've launched at the Colorado Tourism Office as we're starting to launch our in-state travel campaign. We started off last week really with setting the stage for explaining to travelers how we're encouraging them to travel around our state. So the top goal of our care, what we're calling our Care for Coloradans initiative, is to remind travelers of how to travel responsibly and safely. And another goal of this program is to make certain we're providing reassurance to Colorado residents in our destinations that we're educating those travelers before we're sending them their way. And finally, we want to make certain that we are communicating our new interpretation of responsible tourism. In the past, we really encouraged travelers to show care for our Colorado destinations. Now we're broadening that message to encompass taking care of the health of travelers and of those residents who call those destinations home. Next slide, please. And so
Can you unmute?
let me just share with you the centerpiece of this campaign, our Care for Coloradans video. Oops, we need audio. Can we start over again, Mariah? I'm afraid we don't have audio.
Let me try that again.
No, I mean, there should be audio from the beginning, sorry.
Is the audio not working still?
No.
Okay. You know what I can do is when we send the slides out afterwards, I can include the video URL so you can view it then. Would that be okay?
Sure. Yeah, this was, maybe just let it run. It's just 44 seconds, so we can at least share what the main message is.
Okay.
All right. So as you saw, we were, as you saw but didn't hear, we're communicating basically 5 steps to caring for Coloradans and for visitors themselves. And it really focuses on wearing a mask. One of the lines is keep a mask in your pocket in case you need to rock it. Or telling people to make certain they're keeping 6 feet of distance. So we say, how about a ski between you and me? We're reminding people to wash their hands, to stay home if they're sick, and to know. And that really refers to keeping abreast of the local guidelines because as you all know, the reopening across Colorado has been sort of a patchwork. And the guidelines may differ from one destination to another. So we're encouraging travelers to stay on top of that. We're gathering all of this information in what we're calling our Care for Colorado microsite. We just launched this in the last couple of weeks. You can get to this by scrolling to the bottom of the footer of Colorado.com and clicking on Care for Colorado. And then that introduces you to all kinds of resources that we've aimed at travelers for educating them about traveling in Colorado. The tile to the far right of the top row is that video that we just shared. I'm sorry, right in the middle of that top row is the video that we just shared. And then you can sort of work your way through to another, we can go to the next slide now, Mariah. You can work your way through to a lot of other content, including our new Are You Cala Ready brochure. This is what we call the Responsible Travel Edition. We've printed 100,000 of these and we've shared them with our Colorado Welcome Centers, but also destinations across the state to share with travelers. And in the past, we had a kind of a fun Colorado packing list. There was a very heavy emphasis on sustainable travel. Now our Colorado packing list includes such things as, whoops, I think we duplicated the same page, but the Colorado packing list includes such things as a sanitation kit and encourages travelers to bring a mask. Also talks about, traveling like a local, meaning that you wear that mask and that you observe social distancing policies. So next slide. And then we've also produced 2 versions of this poster on the left. We're displaying these in all of our Colorado Welcome Centers. We're working on getting these on the back of the bathroom doors where we have a captive audience for all kinds of content. But this outlines those 5 responsible steps to travel as well. And then we also have other content on Colorado.com right now, expanding on these messages. But we've gathered all of this information into what we're calling our Care for Coloradans Toolkit, because our goal is for this information to be shared far and wide, and we want to make it easy for other people to use it too. Okay, so next slide. One final piece that we're putting together in this whole array of resources is a new training module on our customer service training platform, which we call Colorado Concierge. You can get to it by searching for beacoloradoconcierge.com. It's positioned as a free resource for all Colorado businesses. As you can see, the tile on the upper right-hand corner is our Care for Colorado module. We're introducing a new module in the next week or so. We worked on it with UC Health. It's a new module about traveler safety, and it includes a chapter on COVID containment. We had actually developed that chapter before all of this broke out, or developed that module before all of this broke out. And of course, we realized that we needed to include this current information as well. But we're also going to be developing in the coming months a whole chapter around delivering Colorado-style hospitality in these times and alerting travelers to the kinds of practices that we're that we want them to embrace in these new normal times. One more slide, Mariah. We're getting this out through a variety of tactics. We're spending just a little bit on paid media, mainly with in-state social and in-state native ads. We're sharing that video through this method, but primarily we're sharing this new content through the channels of partners. We're actually opening all of our Colorado Welcome Centers, reopening our Colorado Welcome Centers effective July 1st. And one of the primary reasons we're doing that is so that we can intercept, those out-of-state travelers who are arriving in Colorado. We can intercept them at our borders with this message about responsible tourism. So that's going to be a main role for our welcome centers in these coming months. We're also sharing the message through our Colorado Tourism Office, public relations, and social channels. We're relying on our destination partners around the state to help us amplify this as well, along with other state, city, and county partners. But primarily, we're going to be shooting this out through our Care for Colorado Coalition. And if we can go to one more slide, Mariah. And we've been steadily building this alliance with the Leave No Trace Center for Outdoor Ethics. We're calling it the Care for Colorado Coalition. We have these 8 partners already working with us these days to share all of our sustainable tourism and now our responsible tourism messaging. Soon, the U.S. Forest Service is going to be joining us as well. And we're talking to several other organizations about joining us. But the idea here is that all of these organizations will use their extensive communications channels to share this messaging out to their audiences as well. So we hope, within a month or two, there won't be too many Coloradans who aren't already aware of this, and that many of our out-of-state travelers will be intercepted by this message as well. Because our goal really is to set a new norm for what constitutes safe and responsible travel in Colorado. And we think education is the best path toward accomplishing that.
All right. Thank you so much, Kathy, for sharing that information. I'd like to just introduce Dr. Herlihy to share a couple more remarks with us before we take questions and answers.
Great. Thank you so much. So as Coloradans are starting to think through their summer plans, it's important for all of us to be considering what level of risk is okay for us and for our families. And we know that that is really a personal decision, and decisions around risk really vary from person to person. And so we've developed some useful tools that we have available on our website to help Coloradans think through risk and understand the risk that might be associated with certain types of activities. And so here is an outline of some of those activities and the potentially associated risk with those. Thankfully, much of what we all enjoy about Colorado is our outdoor recreation. We all enjoy, or many of us enjoy, camping and enjoying the outdoor pursuits that Colorado offers us. And so those activities are certainly going to be lower risk on this scale. And as you increase in risk, what you see are some activities that really result in more interactions between people, potentially larger groups of people and closer interactions with people. And that's really where we see the potential for increased risk. And so that might be with slightly more risk, something like going to a swimming pool or going to a restaurant. We believe that there is more risk associated with airline travel than there is with traveling somewhere in a personal vehicle. And so that's part of the reason that we're really encouraging individuals in Colorado to travel locally and really enjoy what Colorado has to offer us here in the state. And then you get to the highest risk activities, which are going to be things where environments are more crowded or there's larger gatherings of people. And so it's important to all Coloradans to really figure out where on the spectrum you feel comfortable and where your family feels comfortable. But no matter the level of risk associated with the place where you are, it's important for all of these activities to, of course, stay home when you're sick, or if you think you've been exposed to the virus. Also important in those situations to consider being tested. Important to wear a mask whenever it's feasible for you to do so in public. To keep at least 6 feet between yourself and non-household members, and of course to wash your hands frequently as well. And we can move to the next slide. And as Coloradans are thinking about their summer plans, some things to consider is whether or not COVID-19 is spreading in their community or the community they're planning to visit. It's important to understand the local orders that are in place in the community as we move into these loosening restrictions across the state and this protect our neighbors phase. We know that there are going to be differences from community to community across the state. And so it's important to understand what the orders might be in your destination. Do you or the people you live with have any extra risks from serious illness from COVID-19? If so, you might want to be more cautious than others might be in traveling at this time. How many people does the activity you're considering involve? It's certainly important to have those considerations in mind. Is the activity inside or outside? We know that for a couple of reasons. Outdoor activities tend to be less risky. Can you keep 6 feet between yourself and others with the activities that you have planned? How long does the activity take? We know that risk of transmission of the virus increases if you have prolonged contact with other people, so considering that as well. How will you get there? As I mentioned, personal vehicles are going to be associated with lower risk than traveling in by mass transportation or certainly air travel as well. If you get sick with COVID-19, will you have to miss work or school? And that's certainly an important consideration ahead of travel plans or making plans in general, is the potential consequences and impact of that travel if it's potentially going to be risky. And then how valuable is this activity to you? Is it something that your family finds particularly valuable and is important to you personally to be able to do this summer? And again, in all of those scenarios, of course, is the importance of wearing masks, using hand sanitizer, of course, washing hands, bringing tissues with you, thinking about spending less time in general with other people, especially with larger groups of people. I think it's also important to have some flexibility in your plans. And if you get to a destination or you arrive for an activity and you feel uncomfortable with that activity and what you're seeing there, certainly be comfortable to change your plans and to pursue an alternative activity if that's what's needed. And that is everything I have for you today. Thank you.
All right, well, thank you both so much for sharing that information with us. At this point, we'll go ahead and open it up for questions. So again, if you've got a question, please use the raise hand function. So just click on the participants button at the bottom of your screen and then the raise hand. That'll let me know that you are ready to ask a question. I'll let you know when you're on the line. And if you could please share your name and then also the outlet that you are with, that would be very much appreciated. First, we are going to have on the line Kevin Torres.
Hey there, Kevin Torres with Fox 31. Quick question for you guys. Is it right now, does this mean that it is safe for people in Colorado to travel within the state? And is it safe for people from outside the state to come in and travel?
Dr. Herlihy, would you like to start and then Kathy maybe jump in?
Yeah, so certainly there we do know that there can potentially be some risks associated with travel, and we really want Coloradans to think through their travel plans and to make arrangements and plans that are really comfortable for you and your family. We want individuals to be able to move about the state, to enjoy especially the great outdoors that Colorado has to offer. We want people to be making those summer plans at this point. And Kathy, I'd love for you to add anything there.
Oh, I think she might be muted. Hang on just one moment.
I'm so sorry.
No
Yes, you know, we know we're still operating in a time of COVID, and so that's why we're encouraging travelers to take precautions, and we hope travelers take those precautions seriously. But we are getting lots of signals, including from CDPHE, that it is appropriate and timely now to travel about the state. We are getting ready to start promoting in-state travel with the blessing of our governor and CDPHE. So, you know, we are advising people to get outdoors, to enjoy those pristine experiences that we have in our back doors in Colorado. But, you know, to take those sensible precautions, including wearing a mask, washing hands, keeping us, you know, the appropriate distance from other people. And above all, you know, making certain that you're familiar with the guidelines in various communities and that you're familiar with which communities are ready to welcome travelers, because not all are.
I just want to clarify really quickly. Does that mean that people from out of state can come in and travel within the state also?
Well, we've never been one of those states that has closed the border or required quarantines. There are a number of states who still have those requirements in place. So really we are, so the borders are open, but again, we are doing our best to make certain the out-of-state travelers who come to our state are educated about these practices as well.
No worries. I completely understand that. Just the last time that we talked about a month ago, there was a 4-phase process. And at that point, it wasn't safe for travelers from out of state to come in. So I just wanted to clarify that with you.
Well, I don't think anyone ever said it wasn't safe for travelers to come in. I certainly didn't say that.
All right, thank you. The next question is going to be from Chris Vanderveen.
Hi, everyone. Thanks so much for having us again. I think my question is for Rachel. I wanted to ask, I know the governor has talked about the thoughts on a 48-hour guest pass that could be issued for people that are visiting long-term care facilities. Is the state any closer to an answer for that? I know we hear from people on a daily basis who want to see parents, and as we near Father's Day, it becomes a more pressing issue even now. So that's my first question. I'll leave it at that. That's my only question.
Yeah, thank you for that question. That is certainly something that we are continuing to work on. We recognize the need for that and the priority for individuals to see their family members that are living in healthcare facilities, and the needs for those family members who are living in those facilities to be able to connect with their family members. And we are certainly working on that. Obviously, it is important to move cautiously and make sure we have the appropriate precautions in place for those types of programs to ensure that, you know, residents of those facilities are first protected by any programs that are implemented. And then we also want to make sure also that the visitors to those facilities are protected as well. We know that, you know, just as there are vulnerable individuals that live in many of those healthcare facilities, that there can also be visitors to those healthcare facilities that are vulnerable as well. And so certainly working on that. I don't have an exact timeline for you on that, but we would be happy to get back with you with more details.
Thank you. The next question will be from Taylor Summers.
Hi, Taylor Summers from NBC News Radio. This is a question more for Dr. Herlihy. Governor Polis has voiced concerns about rising COVID-19 numbers in Arizona and Utah specifically over the last 2 weeks. From your position, what specifically has you concerned about the spread of the coronavirus in those states, and what sort of lessons are you learning from those states that could prevent similar surges here?
Yeah, thank you for that question. So there are certainly neighboring states that are experiencing increases in transmission. And, while we're feeling, um, you know, we're pretty excited about the achievements we've made here in Colorado in suppressing the virus and the decreases that we've observed in our case counts, hospitalizations, our percent positivity data have all been reassuring signs to us. The modeling data has been quite favorable, but we're certainly being cautious. We know through the experience of those states that you mentioned that we're really dependent on human behavior to ensure that we continue to suppress transmission of this virus. From some of those states, one of the things that we have seen is that some states opened up or started easing restrictions more quickly than Colorado did, perhaps. We also know that some states started easing restrictions when their effective reproductive number, that number we talk about called R, was higher, was above 1 potentially, and that's potentially a risk for increasing transmission rapidly. We also, I think, are quite proud of Coloradans and compliance with mask wearing and other social distancing strategies. We believe that most of what is really continuing to drive our low numbers of transmission in this state really comes back to human choices, individual choices, and behaviors. And we're proud of Colorado so far.
Next question will be from Meg Wingerter.
Hello, Meg Wingerter from the Denver Post. I wanted to ask, when you say so much depends on human behavior, but with guidelines, it's very much left open in terms of interpreting what do you consider to be an acceptable level of risk. Do you have any concern about that people may not get the message of what is comparative and what is not?
Yeah, I think that's a great question, and we certainly understood that Coloradans were having those questions and had those concerns, and it's part of what I believe led us to develop some of those risk-based tools that are on our website right now to try and put a finer point on level of risk associated with different types of activities that Coloradans might want to be engaged in this summer. And obviously individuals have different levels of risk tolerance, but we of course want to make sure that Coloradans that are at greater risk for severe disease, for hospitalization, ICU, admission, death potentially, know that it's important for them to keep practicing social distancing at higher levels. We want Coloradans, those over the age of 60, those with chronic medical conditions, to make sure that they are protecting themselves. And so those are certainly the types of individuals in the state that we want to see really we want to see them engaged in lower risk activities as the summer goes on.
Next question is from Molly Dove.
Hi, this is Molly Dove from Aspen Public Radio. I have a question for Dr. Herlihy. In Pitkin County specifically, we've been seeing some restaurants close because of employees testing positive for COVID-19. And I'm just wondering, I have kind of two questions. What is the state's guidance for local public health departments to handle outbreaks in restaurants? And depending on that answer, is there any enforcement going to happen from the state for local public health officials to say these restaurants need to close down for a specific amount of time? So any enforcement plans in terms of outbreaks in restaurants, especially as tourism is going to start increasing for the summer season?
Sure, thank you. So controlling outbreaks is absolutely a key strategy for limiting transmission of this virus in the state. And so we have spent quite a bit of time developing strategies and working with our local public health partners to ensure that outbreaks can be responded to rapidly. We have guidance recommendations on our website for businesses to avoid outbreak situations. to try and limit the size of those outbreaks that as they occur, to report outbreaks to public health, and then control measures to implement once an outbreak is potentially identified. So we do want potential outbreaks, so 2 or more cases in a facility, to be reported early to public health, so that public health has the opportunity to work with those facilities, restaurants, or other businesses to ensure that no further transmission of the virus occurs in those settings. And part of the recommendations there is for businesses potentially to close, and to close early for several days, to really allow time for public health to work with that facility and ensure that case investigation and contact tracing work can occur, that appropriate cleaning can be done, and that important strategies can be put in place before the business reopens. And so that is part of our recommendations to businesses and with local public health partners to try and control outbreaks as they occur.
The next question will be from Blair Miller.
Hi, thank you. This is for Dr. Herlihy, I think. Basically, following up on what Taylor said, but, have you or, anyone else from CDPHE been in contact with other state health officials? Because we saw Arizona make a change to allow local municipalities to allow mask wearing. And then we also see the Nebraska governor, on the other hand, saying that if officials want to require mask wearing, that they won't get any federal money from the state. So I'm just wondering, as we see the difference between Colorado and the other regional states, what the communication is there, especially as we're getting into travel season.
Sure. So as the state epidemiologist for Colorado, I'm in regular contact with my counterparts in other states, so the other state epidemiologists around the country. And some of those conversations are informal, quick conversations with the state epidemiologist in Arizona or Utah, and sometimes they're more formal conversations. And the convening body of state epidemiologists around the country is called CSTE, or the Council for State and Territorial Epidemiologists. And we have several meetings a week where we share best practices. And then, as I mentioned, also informal conversations, lots of email communications, really trying to understand what is happening in our jurisdictions. We all are encountering similar questions and concerns. And so we want to make sure that we're sharing what we're learning with each other. And we have very robust conversations and information sharing between our states.
Before we move on, I don't know if Director Ritter, I know you were maybe muted there for a sec. Did you have anything you wanted to add before I move on?
Oh, no, thank you for unmuting me, Mariah, just in case.
Sorry about that. Thank you. Okay, next question will be from Vinny Del Giudice.
All right. Can you hear me now? I might have hit the wrong button. There we go. This is Vinny Del Giudice at Bloomberg News in Denver. I have questions for Ms. Ritter and Dr. Herlihy. First, for Ms. Ritter, will welcome areas or welcome sites on the highways be offering masks to travelers? And for Dr. Herlihy, do you have any data indicating how successful you've been getting the message across to people to wear masks in public? And as far as gatherings this summer outdoors, how do families safely conduct cookouts like in the state parks or even at home? Thank you very much.
Well, thank you so much for asking that question. We actually are going to be launching a special promotion effective July 1st. We'll be using geofenced marketing just inside the Colorado state line. So it'll be in-state advertising, but our goal is to encourage out-of-state travelers to stop by the Colorado Welcome Center to get a free bandana, a Colorado themed bandana. And that is one of the ways that we're going to entice them into the Welcome Center so that we can share the responsible tourism message. The bandana, obviously, is the mask of choice for a lot of people in Colorado. And it can also be a fashion accessory, but the goal really is to expose these out-of-state travelers to our responsible tourism messaging and to be able to answer their questions that a lot of travelers have these days about where can they travel. And we're going to be offering that promotion. By the way, I should have mentioned this part. That promotion is going to be offered at our 3 biggest welcome centers. That's Julesburg, Burlington, and Fruita. And to get a free bandana, the traveler has to show proof of a paid future reservation at a Colorado overnight lodging.
Thank you. And then Vinny, what was your second question? I know you had one for Dr. Herlihy as well.
Yeah, I think I have them. I can.
Okay, you got it. Okay, great.
Yep.
Thank you.
So there has been some limited national data on mask wearing. Some of that has been just informal polls and surveys done with internet panels. And one particular survey that I did see did make it look like Colorado had, so states were grouped into more likely to wear masks, about average, or less likely. And Colorado was one of the states that was shown as more likely to wear masks. Again, I have not, dug into the statistics associated with those online surveys to validate the methods associated with them. But it is something that we are talking about doing here in the state, is to gather some more survey data to understand mask wearing across the state and understand, if there might be regional differences or different types of places that people are wearing masks, but not in other settings, to really better understand that. I think in general, our sense is that, Coloradans are being compliant with recommendations around mask wearing, but we'd love to have more data to show us the details of that. And I believe your next question was around cookouts and how to do those safely. And what I typically say around, thinking about social distancing this summer compared to, a typical summer is that we're really asking Coloradans to continue to practice social distancing. And what that really means is probably having fewer interactions and probably with fewer people. So it might mean perhaps fewer backyard barbecues or cookouts than you might, or park barbecues or cookouts than you might normally have. And ideally probably with fewer people. So instead of a large gathering, perhaps consider a smaller gathering, so 1 or 2 other families or just a couple of close friends for those gatherings. And I think being in an outdoor environment is ideal in that you can spread out more. We have the benefit of sunshine and climate to really try and modify or decrease the risk of transmission of the virus. And so there's benefits to being outdoors and having those barbecues and cookouts in an outdoor setting versus having indoor dinner parties. So certainly encourage that as a low risk activity in the state right now.
Great. Next question will be from Aaron Prater. All right, Aaron, I think you're on the line. Aaron, we still can't hear you. Aaron, we're still not able to hear you. Would you maybe chat the question to the box, and let's chat it to the whole group and I'll look for it there. So while Aaron's chatting that, this question will be from John Ingold.
Hi, this is John Ingold from the Colorado Sun. Question for Dr. Herlihy is, I was wondering if you have an update on the contact tracing system and how many contact tracers are on the job right now, and if they are helping with the outbreaks up in Boulder, and how that's going.
Thank you for that question. So yes, we have a number of individuals that are engaged in case investigation and contact tracing work right now. That system is continuing to grow. We are supporting Boulder County with those staff. We have both individuals that are working with us through a contact with the Colorado School of Public Health, as well as the AmeriCorps volunteers that you've heard us discuss. They have just come on board, and we are starting to engage them in that work. And so we're really excited and expect those numbers to grow rapidly over the next couple of weeks and really increase our capacity to do case investigation and contact tracing work across the state.
And Erin has submitted her question to the chat. Erin, sorry about that. But she is wondering, this question for Dr. Herlihy, and we're just about time. So I think this will be the last question. Erin is wondering, do you believe that the state has seen any spike in cases it would have seen from the recent protests, or is the spike still potentially coming? That's for Dr. Herlihy.
Yeah, I think that's a good question, and we are certainly following that. We have a number of data systems where we track cases, and as we interview cases, we do ask about participation in mass gatherings. And at this point, we don't have any sort of a signal around individuals attending protests. But I think it's important to keep in mind that, after events where exposures occur, it can sometimes take a while to see case increases. It's oftentimes not possible to see the impact of what we call a first generation of cases. It might take, an individual becoming infected, spreading the infection to someone else, and then those people spreading it to someone else, and those people spreading it to someone else before we clearly see an impact. I think the challenge, though, with that is it's difficult to trace that back to a single event. So at this point, no clear risk associated with the protests that we've seen so far, but we're continuing to do our public health surveillance.
All right. Well, thank you everyone for joining us. I don't see any other hands raised at this time. So yes, thank you very much. I will send out the slides afterwards, and we'll make sure that we will include the link to that YouTube video that we weren't able to have audio on today. I'll include that link in the slides so you can review it later. And thanks again. And just to reiterate, our speakers were Kathy Ritter, Director of the Colorado Tourism Office at OEDIT, and Dr. Rachel Herlihy, State Epidemiologist with CDPHE. Thanks so much and have a great weekend.